Hello learners, welcome again to our second facilitation session. Today on week 2, we'll be covering module 2 titled Occupational Health Problems. And occupational health problems has 6 units under it. And so I have divided module 2 into 3 sections. And today, in our second week, we are covering part A, which is unit 1 and unit 2. The subsequent facilitation under module 2 will be covering unit 3, unit 4, as well as unit 6. Unit 1, an overview of occupational health problems. Unit 2, occupational disease. As we do know that for every module and every unit, we have learning objectives, also known as learning goals. And so for learning goals or learning outcomes for unit 1 and 2 of module 2, learners are expected to learn the meaning of occupational health problems and diseases, to be able to list the different types of occupational health problems and describe the types of occupational disease with the predisposing factors. Explain how working conditions contribute to employees' increased risk for health problems. Explain the preventive measure to health problems. Discuss the management of the common health problems in the work environment. And lastly, to be able to describe the prevention and control of occupational health disease. Overview of occupational health problems, Unit 1. Occupational health problems are diseases, accidents, and other hazards sustained from the work environment in an attempt to perform your duty as an employee. As we all know that when an employee is employed in an industry or in a company, there are various hazards that they are exposed to. And so when they are exposed to this hazard and they sustain an injury or a health problem or accident or disease, this is otherwise known as occupational health problems. What are the different types of occupational health problems that employees are exposed to? 1. Lung diseases, traumatic deaths, amputations, fractures, and eye loss. Nose-induced hearing loss. Cardiovascular disease such as hypertension, stroke. Musculoskeletal injuries such as back injuries for those who work in an industry or company that they have to lift heavy objects. Neck injuries. Occupational health problems in industry. Majority of the people working in industries face or encounter various occupational health problems that affect their productivity as well as lifespan. When you are faced with occupational health problems in your place of work, it affects your productivity and can shorten your lifespan. Problems that you face at workplaces include social and environmental pollution, air pollution, noise pollution, and chemical pollutions. These are common problems that workers encounter or are faced with in their different work environments and workplaces. What do we mean by social and environmental pollution? It simply means increase in migration from rural to urban center of both skills and unskilled workers, which leads to overcrowding and environmental pollution. As we all know, the majority of companies and industries are largely located in the urban center. And as a result of that, many people migrate from the rural settlement to the urban center. And as a result of this, the urban area or towns are overcrowded with people, causing environmental pollution. Air pollution. This is regarded as contamination of air and is a common health problem of industrialization. Noise pollution is a form of energy that is transmitted through the air as waves with varying pressure. Industries such as milling, grinding machines, generator producing industries produce a lot of noise that results or that affects the worker or and also result into health problems to employees, resulting to poor hearing, loss of concentration, irritation, fatigue, restlessness, and even loss of hearing at a later time in life. You see a lot of people during their working time, because of the nature of the work they do and because of the industry they work with, it affects their hearing because they have been exposed to noise pollution. That's why you meet with people, you are talking, but they can hardly hear you. But a lot of people do not pay attention to this and link it to their workplaces. What about traumatic injury? Musculoskeletal injuries, traumatic amputations, bruises, lacerations are the most common health problems workers face, especially where protective measures are not enforced and monitored by the supervisor. Factors that contribute to health problems of workers. The following are some of the factors that contribute to employees' problem in occupational setting. Biophysical factor. The age composition of workers in occupational settings do affect their health. How do we mean? The health problems among the middle-aged employees are hypertension, stroke, palpitations, renal problems, and cancer in some cases. Even depression, anxiety, and other emotional problems due to pressure of work in the families, work environment, and even in the society. These are biophysical factors that affect an individual and causes problems to them during their working uh, period. What about psychological factor? When we say psychological factor, what do we mean? These are health problems that are related to the work environment, whereby the personal behaviors of employee within and outside the work environment causes psychological problem to an individual. A psychological problems of anxiety and stress manifest as a result of stressors associated with work overload, the structure of the company, jobs insecurity, interpersonal and intrapersonal relationships with co-workers, employers, supervisors, and ethics discrimination in workplace. You see, in some companies, some individuals find a lot of stress in their job. They have a lot of problem interacting or having interpersonal problem with their co-workers, even sometimes their supervisor. All this causes psychological problem to an individual. What about social factor? The social environment of the work setting can greatly influence employee health, either positively or negatively. The social interactions among employees, attitudes towards work and health, and the presence or absence of racial and other tensions can affect the health status of the employees and their productivity within the company. Behavioral factor. The behavior of an employee within and outside the work setting can significantly influence the employee's health. Expose an individual to various physical hazards and stress. Lifestyle behavior such as poor rest and poor exercise, smoking, drugs, use of illicit drugs and alcohol use, and poor nutrition greatly influence on the health status of workers and do lead to health problems. Good rest, while good rest and exercise provides physical and psychological relaxation, alertness and relief muscle tension, making it ready to work again. It causes better coordination, reduces hazard, as well as reduce accidents and better work output. Those are the factors that can affect or contribute to occupational health problems. Having looked at the factors that contribute to occupational health problems, how can it be prevented? We looked at the preventive measures to occupational health problems. One, pre-employment medical examination of all employees to rule out presence of any health problems and potential for hazard in the job. Periodic medical examination monitoring of all employees working in high-risk areas such as lead-producing industries, heavy metal industries, asbestos, and cement industries. Provision of safety equipment such as high goggle, safety boots, helmet, apron, and face masks. Regular inspection of food preparation, serving and storage facilities, as well as the environment where they are being prepared. Unit 2, occupational health diseases. Occupational health disease in any condition arising from is any condition arising from work exposures which comprises workers' physical, mental, and social well-being. This compromise the worker's health status as well as reduce the lifespan of the individuals. So we've just defined occupational health disease. What How can we classify occupational health disease? They are classified into the following: respiratory system. When an individual or when an employee has occupational health disease, they can be classified under the following: the respiratory system, the liver, the cardiovascular system, the gastrointestinal system, the urinary system, dermatologic system, as well as the musculoskeletal system. So all the different types of diseases that an employee or a worker sustain or has at workplace can be classified under any of these disease-related system. What are the predisposing factors to occupational diseases? Lack of safety and protective equipment by the employers to their workers. When an employers do not provide a safety and protective equipment to their employees, it can predispose employees to occupational diseases. Non-compliance use of safety materials and company rules by the worker. When the employee as well do not comply to the use of safety equipment and the rules and regulations of a company, it can also predispose such an individual to occupational disease. Poor personal hygiene and poor working environment is another factor that predispose a worker to occupational diseases. Lack of periodic medical investigation of the workers to identify those likely or already developing ill health. For those who are working in high-risk company or industries, it is important to have a periodic medical investigation, and this is to help identify who is already getting affected by their work so that a prompt intervention can be taken and the person can either be redeployed to another department where they are less be exposed to chemicals or problems that would affect their health. Exposure to chemical agents and injection of toxic substances, vegetables and fruits. All these are factors that can cause occupational disease to a worker. What are the ways to discover occupational diseases? As a nurse working in an industry, working in the company. How do you discover or determine a worker that is prone to occupational diseases? Occupational diseases are simply detected through the following: biological monitoring, epidemiological methods, as well as environmental measures. So as a nurse working in an industry, part of your role or activities is to do what we call biological monitoring, and which I'm going to explain later on as we go on in this video. Also, epidemiological methods and environmental measures. What do we mean by biological monitoring? This is a pre-employment medical examination for baseline data and periodic medical examinations. This helps to identify potential employee who is at risk so that proper plan for preventive measures are taken to prevent further damage to the individual health status. Environmental measures. Environmental measures helps to detect hazards in the workplaces before the occurrences of diseases. As we know that early identifying hazards in work environment reduces the adverse effects of such hazard and prevent complications. Epidemiological method. This is the process of studying the determinants and distribution of diseases among workers in order to detect both the occupational and non-occupational work-related diseases among workers. Strategies for prevention of occupational diseases. What are the approach or the strategies for prevention of occupational diseases? Work-related diseases are mostly irreversible. Therefore, a priority should be given to preventive measures to reduce and prevent occupational related problems. Below are measures for prevention of occupational diseases. 1. Elimination of hazardous agents in the work environment. It is advisable to remove all hazardous agents in the work environment, provide a proper and suitable training for all workers before they resume work. Administrative control. No doubt, administrative control is essential to put in check the employees. Provision of personal protective equipment, very, very important. When you work in an industry that produces a lot of gas fumes, it is important to put on your goggle, your mask, and all your personal protective equipment for the period that you are working in that company. Maintenance systems to track hazard and correction. Lastly, emergency preparation for those who are exposed. In conclusion, every occupation has its own risk and hazard associated with it. For that reason, the only way out is strict compliance to preventive measures, which could be the proper use of safety devices, avoidance of unsafe practices, frequent medical assessment, and early treatment of identified health problems. With this, we've come to the conclusion of Module 2, Part 1, and thank you for listening.